For millions of adult Americans, periodontitis is a progressive and chronic disease. The disease begins with an unhealthy balance of bacteria that colonize within dental biofilm. The most prominent periodontal pathogens are P. gingivalis, T. denticola, and T. forsythia, collectively known as red complex bacteria. Research suggests some periodontal pathogens may corrupt the normal immune response, helping harmful bacteria survive and multiply, and the infection to persist and even worsen. Left untreated, a periodontal infection can contribute to increasing pocket depth. SRP alone may not achieve and sustain a healthier balance of bacteria. It may be difficult to access deep-seated bacteria with a scaler, and harmful bacteria left behind tend to recolonize quickly, potentially returning to baseline levels within a few days. When indicated, recommend a comprehensive treatment plan that includes both SRP and a locally administered antibiotic or LAA, like ARESTIN, for the treatment of adult periodontitis. Clinical studies have shown that administering ARESTIN achieves greater pocket depth reduction than SRP alone. ARESTIN works differently than other LAAs with its microsphere delivery system. ARESTIN provides sustained-release minocycline, a broad-spectrum antibiotic that targets infection. ARESTIN starts as a fine powder, making it easy to deposit at the base of periodontal pockets. Once inserted, contact with gingival crevicular fluid begins to hydrolyze the microspheres so they immediately bioadhere. As hydrolyzation continues, water-filled channels form inside the microspheres. The minocycline inside gradually dissolves and diffuses through these channels into the surrounding tissues to achieve and maintain a therapeutic level of minocycline well above what's required to kill periodontal pathogens, and can remain active in the periodontal pocket for up to 14 days. Over time, the microspheres will completely bioresorb, leaving behind a healthier balance of bacteria and a greater reduction in pocket depth than with SRP alone. ARESTIN minocycline HCl microspheres 1 mg is indicated as an adjunct to scaling and root planing (SRP) procedures for reduction of pocket depth in patients with adult periodontitis. ARESTIN may be used as part of a periodontal maintenance program, which includes good oral hygiene and SRP. Important safety information. ARESTIN is contraindicated in any patient who has a known sensitivity to minocycline or tetracyclines. Hypersensitivity reactions have been reported with its use. Post-marketing cases of anaphylaxis and serious skin reactions, such as Stevens-Johnson syndrome and erythema multiforme, have been reported with oral minocycline as well as acute photosensitivity reactions. The use of drugs of the tetracycline class during tooth development may cause permanent discoloration of the teeth and therefore should not be used in children or in pregnant or nursing women. Tetracyclines, including oral minocycline, have been associated with development of autoimmune syndromes. In symptomatic patients, diagnostic tests should be performed and ARESTIN treatment discontinued. The use of ARESTIN in an acutely abscessed periodontal pocket or for use in the regeneration of alveolar bone has not been studied. The safety and effectiveness of ARESTIN has not been established in immunocompromised patients or in those with coexistent oral candidiasis. Use with caution if there is a predisposition to oral candidiasis. In clinical trials, the most frequently reported non-dental treatment emergent adverse events were headache, infection, flu syndrome, and pain. Please see accompanying prescribing information.